Now my pleasure to introduce Vickie Purgavie. Vickie's a board member with the American Lung Association here in Maine, and she has a few remarks for us.
Thank you, Ed. Again, my name is Vickie Purgavie. I'm the Executive Director of the Home Care and Hospice Alliance of Maine. And I'm also, as Ed mentioned, a 12-year veteran of the leadership board, the local leadership board of the Lung Association here in Maine. And from my standpoint as a public health educator, it's important that we really understand the value of healthy air, both indoor and outdoor air quality. Improving the quality of air is vital for human health. Natural defenses obviously protect our lungs from germs and large particles that were spoken about just earlier from the King Middle School children, like dust and pollen. These are the kinds of things that make your eyes water, irritate your nose, mouth, throat, make you cough and wheeze. But most important, it can worsen diseases like lung diseases like asthma, bronchitis, and emphysema. And yes, it can kill you. Healthy air is particularly important to me in my work with seniors throughout the state of Maine. Seniors and the elderly are obviously more susceptible to poor air quality because of underlying conditions that restrict optimal oxygen exchange in the lungs. In addition, weakened cardiovascular and immune systems can decrease their ability to cope with pollutants. At the same time, these same conditions are worsened by inactivity. It is important, as you all know, for seniors, who many of us are becoming, to be able to maintain their mobility and participate in daily activity. It is most concerning that the Northeast has the highest asthma rates in the nation. But it's even more alarming for us in Maine to be one of the highest, or to have one of the highest asthma rates within the region. This is obviously a dubious distinction that reduces productivity at school, at the workplace. It increases hospital admissions and emergency room visits, and places tremendous amount of stress on families across Maine, as well as our entire healthcare system. Out-of-state smokestacks and tailpipes have put the health of Maine children and adults and our most vulnerable seniors at serious risk. But with strong standards in place, much of the health and economic impacts of dirty air could be prevented. For example, if EPA adopts the new cleaner gasoline and vehicle standards that have been proposed, it would be like taking 33 million cars off the road. By 2030, these new standards could prevent more than 2,500 premature deaths annually, 3.3 million days of missed school or work, and create at least $8 billion in economic and healthcare benefits across the nation. Let's be clear, unhealthy air affects all of us. For many of us, it affects our health, but for all of us, it affects our pocketbooks. That's because healthcare costs are never just about the person affected. Healthcare costs spread across our system. We all pay the price every day for every asthma attack, every trip to the emergency room, and every heart attack that is brought about by unhealthy air. That's why we cannot delay in our action to clean up our air. Northeast policymakers, including our Senators King and Collins, play a critical role in protecting and defending the Clean Air Act and ensuring its critical monitoring and enforcement functions, ensuring that they are adequately funded. Smokestacks, tailpipes, research, and enforcement. No more delays, no more rollbacks. Now is the time for leadership on healthy air. Here in Maine, we know that when we work together, we can accomplish great things. But when it comes to air pollution, as you've heard others remark, we can no longer do it alone.